approximately 85% of older adults have at least one chronic health condition, and 60% have at least two. In fact, 90% of the nation's $4.1 trillion in annual healthcare costs are for people with chronic and mental health conditions. One of the main lifestyle risk factors for chronic conditions is poor nutrition. Getting the right nutrition is an essential component not only for good health, but especially for the prevention and better management of chronic health conditions.
Poor nutrition is one of the leading contributors to the development of chronic diseases in the U.S. If you think about our most common chronic diseases like hypertension, diabetes, and heart disease, poor nutrition plays a role in the development of those chronic conditions. But once someone has those conditions, the good news is that nutrition can play a role in preventing the progression of those conditions and in treating those conditions. So for example, if you have diabetes, and you're trying to prevent the progression of diabetes to kidney disease, you can do that through eating the right foods. If you think about somebody with heart failure, for example, a high sodium diet can exacerbate heart failure and make it difficult to breathe, and that can send someone to the emergency department. And so through eating the right foods, you can avoid that and avoid hospitalizations. So the ongoing management of those conditions is made easier with the right nutrition. So a recent study in the Journal of the American Medical Association from Tufts University showed that if everyone in the United States who could benefit from medically tailored meals had access to those meals, we could prevent more than 1.6 billion hospitalizations per year at a price tag of more than $13.6 billion. So just think about that. If we enabled broader access to medically tailored meals, we could really help prevent hospitalizations in the United States and bring down healthcare costs.
When we give people medically tailored home-delivered meals, we've seen over time a significant improvement in both their inpatient stays, or overall utilization, and outcomes in general. We set off on a journey to say, how can we go further upstream and prevent people from having bad outcomes? We thought we're going to start with giving people the proper nutrition. We contracted with a third-party independent evaluator to say, let's look at the claims data, let's look at the actual evidence. They looked at chronic conditions, they looked at post-discharge, and they also looked at pregnant moms. And what we found is over time, in every one of these categories, we saw statistically significant improvements in things like readmissions, potentially preventable admissions, EMS utilization, and what we call low acuity ER visits. This is where people were going to the ER for things that were non-emergent. In addition to better outcomes, we saw significant savings. When I look at the post-discharge program, we saw upwards of $10 million in savings for those folks that had the home-delivered meal intervention. And this was looking at what was their claims history before the intervention and a year after the intervention. And that led to upwards of $10 million in savings. Across all of the programs, we ultimately saw $15 million in savings. We are excited about those outcomes, and we think there's a lot more that we can do in this area.
When we talk about food as medicine, we're really talking about using food to improve health. And to do that, we need to better integrate food into our healthcare system. Mom's Meals is really committed to helping to build that evidence base to demonstrate that when you do incorporate food, like medically tailored meals, into somebody's plan of care, we can avoid hospitalizations and help people maintain their health on a long-term basis.
Mom's Meals makes getting the proper nutrition easy and convenient by providing medically tailored meals to help support most common chronic conditions and general wellness. It's time we made better health more accessible, and it begins with the very food we eat. Mom's Meals purposely designs meals with the power to fill and fuel life.
Mom's Meals began with Rick and Barb Anderson taking care of their own family. They were both caring for their own mothers who were living alone and managing chronic conditions. At the same time, they had two sons who were off at college and were college athletes. And Rick and Barb decided to do better by their family nutritionally. And so Barb started to prepare large portions of family favorite meals and deliver those to her family members on the weekends. They recognized that this was a need for other families, others in their neighborhood, and said, we can build a company around this. And so Barb today is the mom behind Mom's Meals. At Mom's Meals, we offer 9 condition-appropriate menus. So it starts with general wellness. We also offer diabetes-friendly, heart-friendly, renal-friendly, a lower sodium diet, meals for cancer support, vegetarian, gluten-free, and pureed meals as well. So there's something for everyone. Our meals are all prepared by our team of professional chefs and registered dietitians. So they collaborate to make sure the meals meet clinical guidelines for chronic conditions, but also taste delicious.
About 2 years ago, we started working with Mom's Meals on a pilot with members who had congestive heart failure. And we wanted to look at what the impact would be if we provided folks with 6 months of medically tailored meal support. So we saw ER admittance reduced, we saw medication adherence improved, and we also saw that costs went down from about $7 million to about $5 million for this specific group.
Anyone can go to momsmeals.com, whether you're ordering meals for yourself or for a loved one. You can also have access to meals through your health insurance plan. To find out, look for your summary of benefits and coverage document, and that will let you know whether meals are a part of your benefit plan. If you can't find that, don't worry. You can always call the number on the back of your insurance card and just ask. Our meals are delivered right to your home. They're fully prepared, ready to be stacked in the refrigerator. Place them in the refrigerator and they're good there for up to 2 weeks. When you're ready for a meal, you can just heat that in the microwave. It's ready in minutes. Many of our meals also come with sides to round out that meal nutritionally, or you can save them to enjoy between meals for a snack. Things like a cheese stick, an orange, a fruit cup, an oatmeal raisin cookie, for example. We're looking for partnerships and collaboration to bring food as medicine into healthcare.
To learn more or view the wide variety of refrigerated meals available, visit momsmeals.com.